on again? From,
yeah, but even if you say something wrong, pause, start again, I'll just snip it up.
No worries. Cool. So on the inside of the bag here, we've got various different forms of getting access to someone's veins and intravascular access. So here we have what we call our IO needles. So these are intraosseous, so these go into the bone. So we have a drill and we'll stick the needle onto the end of the drill and we'll drill into someone's leg or arm basically to give drugs or fluids in a cardiac arrest or really serious emergencies where we can't get traditional access. Over here we have our fluids. So this is sodium chloride. This is just salty water for a better term, but basically we use this for someone with low blood pressure, someone who's bleeding, things like that, and it's just to bump up their volume and try keep them perfusing. We've also got giving sets which go into the bottle, and then we'll attach this to the end of either the IO or one of the IV cannulas as well, and that'll let the fluids go in. We can adjust the flow rate using this wheel here as well, so we can either put it in fast, slow, or whatever we like. In here we have some airway things. So these are ET tubes, so endotracheal tubes. So this is a form of advanced airway management where we will put this tube down into someone's airway, down towards the lungs basically, and we will inflate a little cuff at the end here using a syringe attached to this, and this will close off the airway and we can then breathe for them through the tube itself. We've also got NPAs, so these are nasopharyngeal airways. So these are very simple airway device that actually go down someone's nose and get their tongue out of the way. It's a basic way of getting someone's airway open, but very, very effective. We also have a catheter mount, and this goes on the end of either the eye gel or the ET tube, and we will then hook a bag valve mask on the end here to breathe for someone. And basically it just allows a little bit of flexibility in the airway tree, and it just means that it doesn't get pulled out as easy. Here we have various different things for getting IV access, so intravascular access into someone's vein. One of the things we have here, this is a flush, a pre-filled flush, and we use this to flush the cannula once we get it in to make sure that it's patent and it's working okay. We've got various types of cannulas, various different sizes, so really, really big down to really, really small. And we'll put these into someone's vein basically, and we can give again fluids or drugs or anything we need to through that. We've got three-way taps. So these are a little tap which can go at the end of the cannula, the end of the IV, or the end of the IO cannula as well. And we can give various different fluids and drugs through this as well, or we can draw up certain doses of fluids, like if we're dealing with kidneys and cardiac arrest or anything like that, we can draw up smaller doses. We've also got needles for giving any drugs we need to either subcut, so into the fat or into the muscle. So again, any drugs like morphine or anything like that, we can give into the muscle. We have various flushes here again, but also we've got wipes, so skin wipes. These are just to prepare the skin before we go in and get some IV access to prevent any infection. We've also got water for injection, so this we'll use for drawing up certain drugs, things like that, and that'll just be going in with the drug to bump up the volume of it. We've got tourniquets, so these are disposable tourniquets. These go around the arm to help increase the vein size so that we can get, again, help us get IV access a bit easier if we need to. We've also got drawing up needles. So these are blunt needles that we use for drawing drugs out of glass and plastic vials. And that's just to make sure no little bits of plastic get into the patient's veins. In here we have a little filter that filters them all out. We've also got various types of syringes. So we've got very small, like this one, which is just a 1 ml syringe, all the way up to a 50 ml syringe, which will take 50 ml of fluid if we need to. 50 ml is generally used for giving glucose into the vein, 10 ml for drugs, things like that. On this side of the bag we have some more airway stuff. So here we have OPAs, which are oropharyngeal airways, and these go into the mouth to get the tongue out of the way. In here we carry the smallest size, which is for newborns, all the way up to the biggest size, which will be for large adults. And that's a basic airway device that we use to just get the tongue out of the way. It's a nice, quick, easy way of getting an airway in a pretty hairy situation. Again, we've got some 10 ml syringes here. We've also got our decompression kits. So these are very large needles that we will put into the chest if someone has a punctured lung, and that's to get rid of the air so that they can breathe properly. We've also got two sizes of McGill's forceps. So these are a special type of device that we use for getting things out of the airway. We have a child's and an adult size here as well, and we'll basically have a look at the airway and then see what we can get out with these. Down here we have a sharps box, so we'll use this to get rid of any sharps that we have safely, and then once we're done with that, that will be disposed of correctly. Here we have what we call a BVM, or a bag valve mask. So this is a breathing device basically that we control. You have a mask which goes over the patient's nose and mouth, and then we've also got the bag which has a valve attached. We open this out, we hook it up to oxygen. This goes over the patient's nose and mouth when we have it connected, and then we can breathe for the patient as we need to. Here we have IV glucose. So this is basically sugar. So if someone's sugars are too low, we can give them this. So this is IV glucose, 10%, just hook it up to the IV if we need to. It is very thick, it doesn't flow in very well. So we'll use a giving set, we'll use a 3-way tap, and we'll use a 50ml syringe to get that into the patient as well. And here we have dressings. In here we'll have various different types of bandages, dressings and things like that. In this one we've also got our laryngoscopes. So these are used to actually get into someone's airway. So we'll stick this down to get their tongue out of the way. If we open it up, it's got a little light at the end. It's a left-handed tool. You go down into the airway, lift up, you get their tongue and their epiglottis out of the way so we can have a good look down into the airway and see their vocal cords as well. All the bags are designed that they can be taken out and thrown to each other if we need to at a big emergency. So we're not having to come to the bag. I can throw it to one of my colleagues and they can get what they need from it as well. And that is basically the contents of a paramedic bag.